Hi, good evening, all of you. This is Dr. Vignesh Kumar. After a long time, I just wanted to speak some few words about MRI scan reporting for the low back pain. Upcoming September 8th is the World Physiotherapy Day. So I just wanted to create an awareness education for this MRI reporting. As a physiotherapist, everybody has to educate the patient, especially on low back pain, because we used to get more number of patients in OPD, in clinics, as well as in the outpatient department of the government set up hospitals. People used to come with MRI scan reports here and there for seeing the doctors, and doctors referring physios or directly access the physiotherapist for taking a treatment for the especially for low back pain is concerned. But what happens, the patient is fully trust on factual type of reporting. What is factual reporting and what is clinical reporting? Because of this, there are two articles recently have been read, the research articles called catastrophication of MRI reports, especially for the patient and surgeon is concerned. More number of clinical reporting in randomized control trial. This is number one article. Number two is the over inducing of unnecessary imaging of the MRI scans to the low back pain. A narrative review recently in China has been done as an article. So these two articles, and previously on 2011 also about the MRI unnecessary imaging type of articles come in Journal of Orthopedic Sports Physical Therapy. So these are all the things, that few things which create an awareness why more number of MRIs are coming up, and which causes 3 times more than that of spine surgeries, invasive procedures for the ordinary low back pain. I just wanted to say some few words here about this low back pain is concerned once again, because it is a research based thing that the MRI scan is only indicated for red flags called serious pathology, which is only 1 to 2% is concerned about spine tumors, cancer or tuberculosis or cauda equina lesion is concerned. So or severe neurological deficits with foot drop like, and only 5 to 10% of the disc pathologies are very serious. The back pain is more than 6 months is considered to be a chronic and not subsided in the conservative managements needed an MRI scanning. Rest of them, 90 to 95%, are totally non-specific low back pain. People seeking compulsorily to take the MRI wanted to check them as self-examination as a treatment protocol nowadays. Compelling a doctors, compelling a physios need an MRI, not rely on clinical examination is concerned, which needs to more number of psychological impacts and causes a bad outcomes to the patient after 6 weeks is concerned. So how to report to the patient? By taking an MRI. More number of MRI over X-rays are now more than 10 times. So the people coming with the MRI scans and bags, they seek about the reporting. So there are two types of reporting I have already mentioned. Factual reporting is whatever given in the MRI, say about the factual reporting to the patient. For example, disc prolapse, disc bulge, lumbar canal stenosis, thecal sac compression, which causes the compression in the nerve root. All this explained to the patient very clearly. So this causes a bad effects to their brain, anxiety, fearness. So anatomical features which has been think for them causes a more number of depressions, leads to a chronic disability. So how to report to the patient? Clinical reporting. This MRI is nothing, don't worry about it, because this has been presented for more number of asymptomatic low back pain, even young individuals itself. It is an age related changes, so incidental. So don't worry about it. This calms down the mind and fear and anxiety will be reduced. So correlating with the clinical findings, that is very important.